Hello and welcome to this mini-gem brought to you by the Association of Elderly Medicine Education. My name is Dr. Grace Lewis. I'm a teaching and research fellow at Newcastle University in the UK. This mini-gem is designed for junior doctors working in Africa. I will deliver a short 6-minute presentation which will introduce the topic of aging in Africa and what this means for you. Firstly, the learning outcomes. At the end of this short video, you should be able to recall the facts on population aging, including projections for the number of people who will be aged over 60 years and living in Africa over the coming decades. Then I will discuss what we know about how this will impact on health services and for you as healthcare providers. And as doctors working in Africa, what will be the challenges you will face and how can you start to address them? Then I would like to talk about geriatrics as a specialty in Africa today, before giving a recap of the take-home messages. Africa remains the youngest and poorest continent. Nevertheless, populations are aging worldwide, and attention needs to be given to older adults living in Africa, not least because of the substantial size of this population. There are already double the number of older adults in Africa compared with Northern Europe, and this figure is expected to grow faster than anywhere else due to rising life expectancies and falling birth rates. Already in Africa, life expectancy for those who reach 60 is 16 for women and 14 for men. This figure from the WHO shows changes in life expectancy with projections until 2050. Although the African region, which is the pink line in the graph, has the lowest life expectancy of all the WHO regions, you can see the slope in predicted life expectancy is steepest, due to factors such as economic development and a fall in deaths from infectious diseases. For more information on this, follow the URL on the resources slide and take a look at the WHO report on global aging and health, which is found at the end of the talk. Why does this matter? Aging impacts on individuals and their health, but also on families too. Within families, older people are often carers or guardians of younger people. They directly shape the younger generation's access to health, education, and other opportunities. Increasingly, in the context of HIV/AIDS, the role of older adults is being recognised. For example, more than 60% of orphan children in Namibia and Zimbabwe are looked after by their grandmothers. In most sub-Saharan African countries, it's common for older adults to remain in the workforce, often working in farming, which encompasses the bulk of food production. In fact, the average age of a farmer in Kenya is 60 years. But what does this mean for me? We can expect to see more age-associated chronic disease. By 2030, the top 10 diseases causing the most disability-adjusted life years in low and middle-income countries will include depression, ischemic heart disease, stroke, and cataracts. Many of these chronic conditions can be prevented or managed, putting an emphasis on the need for good prevention and primary care. This is where geriatrics as a specialty comes in, geriatrics being the branch of medicine involved in the health and care of older adults. Why do older adults come to hospital? There is evidence that the aging population and consequent age-associated chronic diseases are already affecting hospital admissions across Africa. One study, which is referenced at the end of the talk, collected data across 3 hospital sites in Sudan, Nigeria and Tanzania over 6 months, and found that 81%, that's 708 from 874 hospital admissions, were due to non-communicable diseases. Put another way, only 4.6 of the total admissions were due to TB, malaria or HIV/AIDS. And there's a large burden of stroke. Stroke accounted for a quarter of the admissions in older adults. Let's talk about geriatrics in Africa. A paper published in Age and Ageing by Dochin et al. Included a survey questionnaire sent out to representative persons from each African country. Most of the countries which undertook this survey, 25 out of 43, had no geriatricians, and geriatric medicine was taught in the medical schools of very few countries, only 5 out of 40. This human resources problem is just the tip of the iceberg when you consider that geriatrics is really a multidisciplinary specialty involving physiotherapists, occupational therapists, social workers, dietitians, speech and language therapists, and so on,
all of whom are lacking in number and in geriatrics training. This map shows the distribution of geriatricians in Africa according to survey responses in the paper published in Age and Ageing. If you're interested to read more about this study, the reference is at the end of the talk.
This may seem like a lot to tackle, but we think that online e-learning resources such as this are a good place to start e-learning, especially in view of the lack of specialists in Africa to deliver geriatrics training at medical schools and in hospitals. You'll find many more mini-gems in this series available via the YouTube channel, and there will be more to follow which will be specifically designed for an African audience. There are also many other excellent resources online. For example, check out the Portal of Geriatrics Online Education. The link is found on the resources slide towards the end of the talk. Individually too, we can try to change our approach to our elderly patients when we see them on the wards and in clinic, by taking into account their multiple comorbidities and thinking about how these conditions may interact and impact on their functioning and overall quality of life. Other strategies should come from a government or public health organizational level. One such approach is task shifting, which is a process by which certain tasks are delivered by less specialist healthcare workers in order to improve healthcare coverage. In the context of elderly care, community health workers could be utilized to screen for and manage chronic conditions such as hypertension, chronic kidney disease, and diabetes, with more complex cases being referred to clinicians.
In summary, you should now be able to appreciate that African populations are aging rapidly. You should be able to describe the development of geriatrics as a specialty in Africa, and you should now understand what an aging population means for you.
Here are the important papers referenced in this talk. Please check them out if you're interested. Follow these links for more useful resources for your learning, the Mini-Gems YouTube channel, a key report by the World Health Organization, and some longer interactive online modules. Enjoy. Thank you for listening. We are really interested to hear your opinions on this topic, as well as feedback on the Mini-Gems as a way of learning. We would be so grateful if you would follow this link and answer a short questionnaire for us. Thanks again. Thank you for your attention. After completing the survey, please take a look at some more mini-gems found on the YouTube channel. We hope you've enjoyed this talk and found it interesting.